First of all, I want to introduce myself a little bit. I'm into urology for, I can say now, several decades, and I started my training in the University of Innsbruck, where I was the vice chairman for about 10 years. Then I was here in Vienna already for a short period at the University Hospital for half a year. My next station was then Linz, where I was chief of a department of urology, and finally I stopped in Salzburg, where I was the chair of the University Hospital in Salzburg. And now I'm working on two places, still in Salzburg, but in a private place in Salzburg, and here in the Rudolfina House in Vienna. And my training was in many fields in urology, including even pediatric urology and stone surgery, but the main focus was always one side, oncology, big surgery in oncology, and then the second, laparoscopy, where I started very, very early at about 1992. Well, it's a little difficult to answer what is new in minimally invasive urology. I would focus just on laparoscopy, because this is a large field already. And what is new mainly is that most surgeries now are done by means of laparoscopy, and this is very new, and this is really a change in paradigm, because several years ago people couldn't believe that all those surgeries could be performed by laparoscopy, and now it has become common use, even state of the care for many indications in oncology, but also reconstructive surgery. When we talk about what I can offer to international patients, we have to distinguish between what the place by itself can offer and then what in addition I can offer personally. And the place itself has a great tradition many years ago, and it's still, I would say, the best, but certainly one of the best private hospitals in Vienna. And there are many competent colleagues also working here. There's a lot of competence in surgery, in the ORs. The nurses are well trained because they have to deal with many different surgeons every day, to do many different procedures every day. So this is a very highly qualified staff. And if there is a problem, which is not just urology, but maybe general surgery, gynecology, whatsoever, then there are many colleagues which also can help. So this is just the setup here. The second is what I can offer. And I can offer specifically just all kinds of laparoscopic surgery, I would say, in the highest standard available. My philosophy of medical care has developed for many years, and I feel it's very important that you give the given patient the best care which is possible, and without any compromise. And you shouldn't do something as a doctor knowing that somebody else could do it better. So if somebody can do it better, you send your patient there. But if you feel that you can do the best which is possible, then it's your job. But if it's your job, you have also to do this job very good. And the next thing is complication management, because every doctor will have complications. And the difference is not that he has complications, but also how he cares about his complications. And it's also very much important really to do the best treatment possible just for your complications and not to run away as some do.